I'm Ruth O'Regan. I'm a professor of medicine and division chief for hematology and medical oncology at the University of Wisconsin. Firstly, there's no data out there that basically has shown that a woman who gets pregnant after a diagnosis of breast cancer has a higher risk of recurrence because she got pregnant. And amazingly, this is true whether the cancer is estrogen receptor negative or estrogen receptor positive. So that's the first thing I say to patients, because obviously they've just been diagnosed with a breast cancer. They were thinking about getting pregnant, and now they've got this whole diagnosis making things very complicated. So the first thing I always say to them is I reassure them that there isn't a risk in terms of their breast cancer recurrence being higher if they become pregnant. Now, most times what we recommend doing is waiting at least 2 years to try to get pregnant, because that's the highest risk of recurrence in the first 2 years. It's just a practical point. Um, what becomes tricky is, in some ways, if the patients have an estrogen receptor negative cancer, it's actually a little bit easier, because then you give them their chemo, the periods come back, they wait 2 years and they can try and get pregnant. When they've got an estrogen receptor positive breast cancer, however, then they're going to end up on endocrine therapy. And a lot of times I would tend to use tamoxifen in this scenario, because then you can kind of monitor their menopausal status. What I typically would recommend again is that they would take at least 2 years of tamoxifen before trying to get pregnant. And one of the important things is we strongly do not recommend women get pregnant on tamoxifen because of potential risk to an unborn child. So you have to make sure, given the long half-life of tamoxifen, that the patient is off tamoxifen for probably at least 3 months before she tries to get pregnant. And it's an interesting drug, tamoxifen, because it was initially developed as a contraceptive, but then when they started doing some animal studies, they actually discovered that it actually is a fertility agent. So you have to make sure that patients are using adequate contraception through those first 2 years on tamoxifen. So what I would typically do is at the 2 year mark, they stop the tamoxifen, wait 3 months, try and get pregnant. And then after they've had their children, then you put them back on tamoxifen. Now, all of this data is retrospective, but again, there is enough data out there showing that it's safe to do this. And I think it's very important for patients to hear this. There is actually an ongoing study looking at, these breaks in tamoxifen in these younger patients that want to get pregnant, and how safe it is. But just to reiterate, I always just reassure these patients that there is no risk to them if they want to get pregnant, even though you've got a higher estrogen kind of situation and higher circulating estrogen when they're pregnant. For whatever reason, that does not increase the risk of recurrence. And I always say to them as well is that when initially we were learning about breast cancer, estrogen was used to treat estrogen receptor positive metastatic breast cancer. So our understanding of the role estrogen plays in estrogen receptor positive breast cancer, I think, is a little bit unclear in some ways. So as I say, I think it's safe. We recommend waiting the 2 years, 2.5 years, I guess, if you've been on tamoxifen. And after that, let them get pregnant, and then they can go back on tamoxifen afterwards.